Well, I'd like to welcome everybody back to Alabama Care. And today we have Mr. Byron White with us. And Mr. White is the director of the new Community Waiver Program at the Alabama Department of Mental Health. And at this point, I'd like to hand it over. Mr. White, if you would introduce yourself.
Hello. Thank you for the invitation today and the opportunity to talk a little bit about the Community Waiver Program here at the Department of Mental Health. Give you a little background of kind of how I got here, and hopefully we'll be able to talk about where we're going with this new initiative. Personally, I have been around for a long time. I'm a lot older than I look. I started off many years ago at vocational rehab at ADRS as a rehab counselor and got really interested in supported employment and eventually became the director of supported employment there for quite a few years, and then had an opportunity to come over to the Department of Mental Health and really assist the agency with some hopefully development of supported employment services. The model here for a long time that we're trying to really move away from was more facility-based services, not really a lot of emphasis on people with disabilities receiving waiver services, working in the community in competitive employment. So back in 2008, when I arrived, we began addressing our low employment numbers in Alabama. And, I made a note here, while we're always in college football, Alabama and Auburn always striving to be the best and be number one, our employment numbers nationally rank near the bottom when you look at national data, sometimes around 5%. But, I will say this, while we can get discouraged when we look at these low employment outcomes, there are some encouraging signs as well. We've done a lot of work in recent years to provide supports to our provider agencies on how they can begin to shift away from that traditional facility-based service, really addressing sheltered workshops. And I'll tell you, that's one thing that has drastically changed in our state. We currently only have 4 active sheltered workshops still operating, and I would say probably most of those 4, it's a small operation. It's not large contracts like some have had over the years. Now, when you think about 4 in Alabama, you may say, well, how does that compare to other states? And so I looked at a little of the data just to give you some comparison. Arkansas, they operate 32 shelter workshops currently. Georgia 18, Kentucky 29, Louisiana 21, and then if you look at a larger state like Illinois, they still have 138 sheltered workshops. So again, this is drastic progress. I think probably at one time we had more than 20 active shelter workshops across the state where folks were being paid piece rate and sub-minimum wage. So again, while we may be at 5% of employment outcomes, there are signs that we have made some tremendous progress in recent years. I will tell you, as we started thinking about things we might do. Go ahead.
I was going to ask, we first met at the ALAPSE conference about 2 years ago. And I know that you have a decent amount of background in employment there. And you mentioned that 5% of current Alabamians are in inclusive working environments. What is kind of the high end nationally? Go ahead.
Yeah, let me clarify that now. That's 5% of the people receiving waiver services in Alabama have achieved an employment outcome. That's not necessarily the percentage of people with disabilities working in Alabama. It's the people that receive our waiver services. That's, again, okay. Their service has traditionally been a facility-based day program, not working competitive employment. Some states it's as high as 10 or 12 or 15% of people receiving waiver services are working competitive employment.
Okay, I got you. So you have quite a bit of experience in supported employment there, but what about how does the new community waiver program fit into that? And what was kind of the story of how this new waiver came about?
Okay, so as I was thinking about this today, I recalled a thought probably some of us had here in the division maybe 5 years ago. We started thinking about the possibility of developing an employment waiver where folks that would enter into services for the employment waiver, that would be the goal, that they get a job, starting off kind of small with a limited number of available slots. And I think from that initial those initial kinds of thinking and talking with people, it got a lot bigger than an employment waiver. It became a community waiver program. So the past couple of years, there has been a tremendous amount of work that have gone into the development. I will tell you, for those that have not heard, the waiver was officially approved by CMS last week. So after more than 2 years of prepping and preparing and developing, it has received CMS approval. I will also tell you, in a meeting with CMS a couple of months ago, as we were getting close to receiving the approval, they were very complimentary of our state, that this is really almost a one-of-a-kind waiver, taking our state in a new direction. So we have an opportunity here to really set a path for other states going forward with what we expect this waiver to do in Alabama.
I feel like Alabama is going to start to lead the nation in a lot of categories. I feel like some people, when you see stats, Alabama may fall kind of toward the bottom on some of those stats. I feel like in the next 5 years, a lot of the states are going to look to Alabama and say, what are they doing right? Because they're blowing it out of the water. I'm very grateful that we have the team at ADMH, ADRS, people like yourself leading that. Now, the community waiver program has its roots, sounds like, founding in employment, but what other services does it encompass, or what other services can individuals receive on the community waiver program?
Yep. I will tell you, this waiver really focuses on 3 distinct kinds of outcomes: integration, employment, and independence. Those are 3 things that we expect to happen as a result of the CWP. People become more independent, they become integrated in their communities, and they have a competitive integrated job.
And I noticed that, go ahead, I'm sorry.
No, you go ahead.
I noticed on the page for the community waiver program, it mentioned that the community waiver was really meant to step in before a crisis was had with the individual and with the family. And I'd like you to define what a crisis is when looking through the eyes of the CWP.
Yeah, well, crisis is a term that many of us in our personal lives could be familiar with, but for folks that receive waiver services, or in many cases have not received waiver services, have reached a point of crisis before they were able to access services. So in our existing legacy waivers, the ID and living at home waivers, in our waiting list process to get into service, you had to, eventually work your way up to the top of that waiting list to enroll in the ID or living at home. And the way you got to the very top, guess what? You had reached a crisis. And that could be that you're having some type of medical, emotional situation. Many times you're at the point of becoming homeless. And so since you've reached that point of being homeless, or maybe locked in, sometimes even in a jail or a hospital with no options, then you finally get to that point where your criticality allows you to reach the top of that long waiting list and get into services. And so this CWP has a different enrollment process that allows us to reach people before they reach a crisis in their life. So that is one of the, definitely a positive with the new community waiver program.
Yeah, and I've heard it. There's a way I understand it, that the kind of the old way of enrolling and getting those services, ID and LAH, was, for example, if you were receiving some help from family, or living with your parents or your grandparents, and they were to pass away or to get in a car accident, and nobody was there to really help you, and you needed immediate help, and you would have to go into, in the old ways, kind of an institutional setting. And that would skyrocket you to the top of that waiting list, and then you would be first to receive one of those services. And this new community waiver program is trying to reach individuals and families before that happens. A lot of people on the waiting list that maybe are waiting for services and say, look, we want to get to you guys earlier and start these support services now, so that whenever that transition happens, you guys have the tools and we have your back to make sure that you continue living your best life how you want to live it.
Yep, and I will tell you just a little bit of the whole, process of accessing the community waiver program. Individuals will still need to call our 800 call center number to apply for waiver services and go through the process of eligibility and get placement on the waiting list. That part has not changed. There's one minor addition, or I guess eligibility possibility in the CWP that's not available in the existing two waivers. And I guess I'm going to try to clear that up a little bit. So eligibility is an IQ under
Yes, sir.
70, so 69 or below, and then deficits in some of life's activities, functional limitations, expressive language, et cetera, et cetera. We have one of the enrollment groups, enrollment group number 5, that I'll talk about a little bit later, that can actually provide services to someone who is not quite as I guess disabled. I hate to, that's probably not the appropriate, it just doesn't quite meet the traditional eligibility. They only require to have one functional limitation in life's activity. So we have some slots. It's a limited number of slots. A lot of times that's younger people, maybe exiting school, who have the IQ under 69 or under, but they don't have that three limitations, and so they only have one. They could possibly receive services in the CWP. So getting away from that reaching number 1 on the waiting list to get into services, we now are using enrollment categories. And we also look at the length of time on the waiting list. So here, folks that have been on the waiting list for a long, long time may be some of the first folks to get contacted about enrolling in the CWP. And I do want to make sure that I mention to the audience that the CWP for the next 2 years is only available in 11 counties. This is a demonstration waiver, and so for the first 2 years, we are in all 5 regions, but only in 11 counties. And let me just mention those 11 counties that so
Yes,
people will
sir.
be clear as they're listening. Is this possible where I am? So in Region 1, it would be Morgan, Limestone, and Madison counties. In Region 2, Tuscaloosa and Walker counties. In Region 3, Mobile and Baldwin counties. Region 4, Montgomery, Elmore, and Houston counties. And in Region 5, Jefferson County. So those are the 11 counties where CWP services will be available.
Now,
I'll
you
also
mentioned that this
say,
is a. Oh, go ahead. I'm sorry.
you go ahead.
You mentioned that this is a demonstration waiver, and that's the first time I've
Mm-hmm.
heard that phrase. What exactly is a
Mm-hmm.
demonstration waiver, and what does that mean for the longevity of this waiver?
Yeah, it's really to give demonstration gives our state some flexibility in the way we design and deliver our program here. And then it evaluates our state-specific policies and procedures to see if we're getting better outcomes for Medicaid populations. So you
Mm-hmm.
don't want to use the word pilot, but a lot of times people confuse demonstration with a pilot. It's kind of like a new way of doing things, and your evaluation component shows that as a result of this demonstration or new way of providing services, you're getting better outcomes and possibly even at reduced costs.
Yeah. So as you wouldn't want to throw all of your resources behind something that hasn't been tested before, you kind of want to, walk into the water slowly there. But and when is that reporting data due back?
Yeah, it's
Is it like
ongoing.
5 years? Okay.
It's ongoing. It'll be ongoing data, yes. And we have outside consultants that will be involved in the collection of the evaluation data of the CWP. I will tell you this: we got actually designated designation from the state legislature, I believe, Alex, in 2019 to support the launch of this waiver. And going forward, I will say this: the ID and living at home waiver is still an open waiver. It's not closed, but it will not be available to people in the 11 counties. People coming into service in the 11 counties, the CWP will be their option. And we have projections of what the numbers for this waiver will look like. So for the first year, we're expecting to enroll 500 people in the CWP. And then each year, that number will grow up to the 5th year, where we're projecting between 1,600 and 1,700 enrollees in the CWP. And that would be with no new money from the state legislature. That will just be utilizing attrition slots. So as people move, pass away, those slots will be transferred over to the CWP.
So for families that have been on the waiting list, or maybe they have younger sons or daughters that are looking to receive services, they can count on maybe not getting into the ID waiver, but the CWP waiver in the future.
If they, yes, yes.
If they're
Right now
eligible.
it would be the
Now,
11 counties, but again, as we expand, this will be expanded to other counties, of course.
Now, I have a family member that receives services under the ID waiver, and my question would be, is the ID waiver being phased out and she's going to have to transfer waivers?
Let me say my understanding, let me clarify by, my understanding is we are not closing the ID and living at home waiver. We're just not enrolling new people in the ID and living at home waivers. Does that make sense?
Okay.
So we're
Yeah,
not
so
going to
over
come in
time
and say,
it'll
oh,
be phased out.
yes, but nobody's going to be forced to switch from one to the other.
Okay, good, because I know there's some paperwork behind that that can get a little tricky and fine detailed, and I don't like doing that to be a little strenuous, but we'll do whatever we have to do. So you mentioned integration, employment, and independence. What does integration mean to you, and what does it mean to this waiver?
Okay. I will give you my interpretation, and I think it really supports what we intend to do with the CWP. I mentioned Alabama has a very long history of people receiving their services in facilities, day programs, especially day services. Now, not getting into and not confusing our subject matter today, we did an excellent job of closing our ID institutions. So we're probably one of the first states in the country, again, we should be proud of, that we've closed all of our institutions. But, folks that maybe left the institutions and moved to group homes, sometimes their day looked like going to the ARC and spending the day where they were doing socializing and other kind of activities, but not much opportunity to get out in their community and do things like we do. Go to the park, go to the library, get involved in some exercise classes, just the same things we would do. I mean, we don't need to really separate it. It's just whatever community is to you and I. We expect the same for the community to be for the people that we support in our waivers. So that's what community integration is for me, and really putting a push, and nationally we're being pushed by the settings rule that, CMS is really saying we want people supported in the communities and where they live to be part of their community, not separated out or segregated. So that's to me what the community integration is.
Now, when I think of when you're talking there, that makes me think of, some people might not have experienced non-integration or seclusion, but I think we kind of got a dose of that in the last year or two with the pandemic, and not being able to enjoy the things that we typically take for granted. I like getting out. I like meeting people. Those are some of the things that really brighten up my day. And I wasn't able to do that during those times. I wasn't able to go play hockey. I wasn't able to meet with people and, just joke and laugh in person. So when you talk about integration that way, it's been a struggle for me the last few years during the pandemic. And for individuals that, have that ongoing continually, I feel for them right now. So I thank you for describing it that way.
Yeah, and you think about us, we sort of plan our day and we plan our life, but historically, most of the people we support, probably other people plan their days and their lives for them. So we're really hoping that HCBS, the settings rule again, continues to push that individuals have the say in what their life looks like. That's really the goal. That rather than you or I making the decisions for them, they're making their decisions of who they want to be around and what they want to do. And us, of course, providing the supports to make that happen.
Yeah, and you guys are doing a great job of that through the person-centered planning, and the individuals that are helping, those individuals learn what that is and how to make those personal decisions. And we talked about employment, and then is there anything that really stands out about independence to you in the new waiver and what that means for, if an individual is saying, I don't know if these services are right for me, what does independence mean there?
Yeah, well, let me do a little more clarifying on the CWP. So I've talked about, you've heard me say facility-based services a couple of times, and that's been our model. With the CWP, there are no facility services. There are no day programs. Everything is community-based. We're trying to keep people living in the homes of their families or assisting them in moving into their own apartments, not in, a provider-owned group home. So that is the independence part, helping people by providing the supports they need to be independent, again, to continue to live with family or friends or live in their own apartment with the necessary supports to make that happen. So that to me is a huge difference in the new waiver, because I will tell you, I don't have the percentage. I think I heard it's as high as maybe 85% or higher of our funding going to residential services for the folks on the two existing waivers. That many people are receiving, group home kind of services, and this CWP is shifting that money so people can have their own places again, that they're on the lease, they have the apartment or the home, or they're able to continue to live with their family with appropriate supports, going in to assist the family and assist the person.
Now, when you mentioned that the CWP will not necessarily be providing services for the individual living in a provider, I believe a lot of the providers hire and train the caregivers. So if that's not the case where these individuals are going into the providers, it sounds like there's going to be a big need and a big market for independent caregiving companies to fill kind of that gap. Is that what you're seeing there? Or do you think that will?
I was going to talk a little bit about some of the services when we get to that point of what, some of the services in the CWP and in the different enrollment groups. And in fact, I'll kind of shift to that for a second, talk about some of the services that are in the new CWP, and we can think about who those service providers might actually be. Let me backtrack just a second and talk about the enrollment categories. I mentioned moving away from the traditional, waiting list process and reaching a crisis, that now we actually have enrollment categories. And there are 6 of those, and I don't want to get too deep in the woods because, again, I don't have a visual. So just think about category 1, and I'll give you a little bit of the, details. So category 1 is on the waiting list. It's a person that's age 22 or older, and their goal is to preserve their family independent living situation, and they want to obtain employment. So that's a person on the waiting list, and that's their goal, to continue to live with their family or in their own home, and they also want to have a job. Category 2 is a person that's on the waiting list, 22 or older. Their goal is to preserve their current family living situation or live independently in their own residence. Not necessarily at this point interested in working. However, that could change later on, down the road. Category 3 is not on a waiting list, but applies through ADMH. They're age 22 or older, and they have a goal to preserve their current living situation with their family or live independently, and they also have a goal of competitive integrated employment. So that could be someone that comes directly into service at application. Category 4, they apply through ADMH, age 22. Their goal is to preserve the current family independent living situation. Not really any interest in working at this point. Category 5, I know, again, this is a lot of information I'm throwing out, but I do want to get through the 6 categories. Person on the waiting list, transition age 16 to 21. The goal is to continue to be able to live with their family or eventually in their own home, and they want to obtain a job once they exit from school. And then the last category is category 6, not on the waiting list. They apply for services, transition age 16 to 21, want to live with their family or in their own home, and the goal is to obtain employment once they transition from high school. So I throw all that out. People don't need to get lost in those details. Again, I would say if you're interested in services, contact our 800 number, the call center, for more information at that point. And then from that, I was going to talk a little bit about the enrollment groups, unless you have a specific question.
I do. I love that there are the amount of resources that are being given to that transition period when the school system ends for that individual. Because at that point, a lot of families and individuals have that pain point of what next. And sometimes those conversations are had a little late. And then the only thing that's available is to go to your local provider. So you're contacting them right at that point and saying, hey, no, it's still possible to live where you are, where you're comfortable. with who you want to live with, or, move to a new place. And then that will set them up, for years to come. So kind of hitting that when that pain point approaches, I think is a great idea. And I had a question there. Is there a year gap between graduating out of the education system and possibly receiving this service? Do you get, is education up to 21 or is it through 21?
If you turn 21 during your last year, you would finish your year, but you wouldn't return after that. So people typically, they can remain in school until the age of 21. So that means if they're in school, their exit year, they're 20 years old in August when school starts, they turn 21 in February. They're not going to kick them out in February. They'll finish the school year, but they wouldn't return after that.
But there is an opportunity there where there might be a few months where the person is out of the school system and not eligible for the 22 plus services through the CWP.
Alex, that's a good question for us to get some clarification on. I would say this. Go ahead. See, we have category 5 is 16 to 20. No, category 5 is 16 to 21. So some of the categories start at 22, but then category 5 is age 16 to 21, and then category 6 is 16 to 21. So you have two categories there that the person you just described in between 21 and 22 could enroll in one of those categories.
Gotcha. That makes sense.
They're both
kind of hit them a little bit. Yeah. All right. Yes. Perfect. So you're able to give those services at a younger age and prep the individual and the family ahead of time for that.
So I'm kind of thinking the person in. I'm kind of thinking a person in school would probably want to, access that category 5 or 6 before they reach 21. And if somebody had already exited and now they're 21, 22, 23, 24, there's an option to come back.
Okay. Now, do you see that? Well, no, you said this waiver is going to be for people that aren't receiving service. I was wondering if there's going to be a mass exodus of individuals leaving providers and going back into their homes.
Again, right now, remember the people that are in those provider-owned residents are on the ID and living at home waiver. So that could potentially in the future become an option. But for the first couple of years, we will not have people transferring from ID into CWP.
Yeah, makes sense.
But, I would say this think about this, word of mouth really influences people. So people who may have thought they never wanted to work, as they see their friends begin to get jobs and start earning money, or see their friends and acquaintances start getting their own apartment and hearing how wonderful it is to live in their own place, I certainly can see where that would influence others to want to move or get a job.
And that's the positive aspect of peer pressure.
That's it.
Yeah. Yep. They say you're the average of the people you spend your time with. So you start to see other people, advance and do the cool things that you want to do. It'll make you want to do those things as well.
Yep. Let me talk a little bit about the enrollment groups and the services in those enrollment groups. Again, it's a lot of information, so I'll try not to get too detailed to confuse people. But there are 5 enrollment groups. We had 6 enrollment categories, and now we're talking about enrollment groups. So now we're moving from the waiting list into one of these 5 enrollment groups. So enrollment group number 1 is children ages 3 to 13 with an intellectual disability who live with family or other natural supports. And some of the services they would receive, continue to live in that family home, could be things like support coordination, personal assistance in the home, personal assistance in the community, independent living skills training, possible community transportation, positive behavior supports, respite care, family empowerment, system navigation, counseling services, assistive technology, individual directed goods and services, and minor home modifications. So, and I will tell you this, I didn't list the expenditure caps, but each enrollment group does have an expenditure cap per year. But that is enrollment group number 1. So that's the group 3 to 13. And also we have a designated number of slots across the state for each enrollment group that of course would total the 500 slots when they're all added together. And I didn't include that information either because it's really not relevant to our topic today. Enrollment group number 2 is transition age youth 14 to 21 who live with family or other natural supports, or if they're 18 to 21 could possibly already be living in their own home. And you have most of the same services that I listed in the enrollment group, with a few additional services that certainly could be beneficial. Things like financial literacy and work incentives counseling services, assistive technology, remote supports, housing startup assistance. So someone wants to move into their own apartment. That startup is always a challenge. Startup to get maybe furnishings or get deposits paid on utilities. And there's the housing counseling services to help folks navigate through all of that. Again, certainly those are services that would support a person becoming much more independent than they would currently be living in, the family home or in a provider-owned residential program. Also in Group 2, one of those services we're really interested in is employment services. So all of our employment services are part of Group 2. Group 3, enrollment group number 3, is working age or older adults with ID who live with family or other natural supports, or they can be living independently in non-intensive supported living arrangement. And it's really all of the same services that I just mentioned. And again, these are folks that
quite a bit there.
Go ahead.
I love how the services, there are numerous services there for the individual, but there's also services there to support the family.
Right.
And teaching the family how to further support the individual and advocate, build self-advocacy, family advocacy there. And you mentioned that service for moving into a new apartment. I remember when I first moved out of my college dorm into my first apartment, and it was hectic. I didn't really know what a lease was. I didn't have any furniture. I hit the Goodwill like crazy. I got this great desk for like $50. But it was trying to figure that out on the fly.
Yep.
And if I could have had somebody there to really help that transition, I know it would have been a lot more, steady for me at that point.
Absolutely. I will tell you, let me just talk just a second about employment services, because that's, my background is employment, and I want everybody to be able to live independently and be able to be part of their community, but I'm really interested in getting a job and being employed. We will be, of course, working very closely with vocational rehab, somewhat braiding our services. There's a piece of the employment process that we want VR to continue to support. I mean, they're the experts that get the federal funding to put people with disabilities to work. So we will have some pre-employment services available in the CWP. Things like the opportunity to do some exploration. Maybe somebody gets asked, do you want to work? And if they've never worked or don't have an understanding of the concept of work, there's an opportunity in this waiver to do some exploration to really get a look at what working really means. Maybe taking some company tours, talking to a benefit specialist about how that might impact my benefits, just getting a better understanding when we say, would you like a job, what that really means. But once the person says, yes, I do really want to work, then we expect those folks to get referred to VR and work with that VR counselor and get the job development and initial job coaching services through VR, and then receive the CWP post-employment kind of services, long-term supports to help them continue to work after VR has closed a case and moved on. The thing with VR, it's a time-limited program. They open a case and close a case. With waiver, most of the time, it can be a lifetime. You can be on the waiver for a lifetime and to continue to receive the supports you need to make sure you have your best life. So we do anticipate even a better partnership with VR. And I'll tell you right now, we're currently training VR counselors. In fact, Tina Dortch there and we have some training set up next month to do an overview with VR counselors, getting them ready to expect some new referrals coming from ADMH waiver recipients and be ready to go. And also, I will say this, most of the employment providers under the CWP are current VR employment providers. So the good thing is we already have trained employment providers that are already working with VR and also with us under the existing waivers.
And we've had an opportunity to do a few broadcasts with ADRS and VR. on employment. And it's very nice to hear that you're going to continue working and strengthening that relationship, because everybody we've had contact with, the individuals that receive services through employment, speaks nothing very highly about VR services. And so I'm glad that that structure is there and that you guys are continuing to,
and
strengthen.
it's also a CMS. Yeah, it's also a CMS requirement. We have to access VR first before we start utilizing Medicaid dollars on a service that's available somewhere else. So, we're required to tap into that VR service and only provide some of these services if VR would not be available for some particular reason. The good thing is, though, that while they're receiving some VR services for employment, there would be other CWP services that the person could receive while working with VR. So it's not like the whole CWP gets suspended while they're receiving VR services. They would receive other services outside of what VR is providing at the time.
Gotcha.
So we got to enrollment group. We got to enrollment group 4. We're back to our person ages 3 plus with ID who are unable to live with family or natural supports or live independently. So this gets to where a person possibly could end up in some type of residential service. It's group 4. It has a limited number of slots, and you would also have some assessment things in place to really show that other options have been explored, and for whatever reason, this particular group is the best option for the individual.
Mm-hmm.
So here you have support coordination, employment services are available, coworker supports, personal assistance in the community, and then I eventually get to the community-based residential services. So that is group 4. And our last group is group 5. This is working age adults 22 and older with ID, and this is that group I talked about that doesn't meet the ICAP score with the 3. This person only requires 1 functional limitation. That is group 5, and that's a limited number of slots, maybe I think 24 out of the 500 would be that enrollment group number 5.
And as we're going over this, I kind of see 2 areas that I would want to have strong relationships with as well. One is housing, affordable housing. It's tough. The rental market keeps going up. Rent costs more. Houses are costing more. So I'd want to have a good relationship with quality housing. And then the other one is, if these services are being provided to the individual in their own home, it's going to require, if they need the services, it's going to require people to be on site. And so there's going to be a need for qualified caregivers or support coordinators or whoever that looks like to provide those services one-on-one. And so I'd want to have a good relationship with a lot of caregiving, companies or entities. Is that kind of the thinking as well behind there?
Yeah, and I will say this: I didn't get into a lot. I didn't get into details, but many of these CWP services can be self-directed, so the recipient can actually hire their own staff. They can find their own employees to provide services. We're really expecting self-direction to expand under the CWP. And I will say this for providers: we have a provider network manager on staff here full time now. That's really the person's primary job, is to continue to recruit, train, and manage our list of providers across the state, and that is ongoing. And as this waiver grows and we need more providers, we will be adding those as we move forward.
I had a friend, someone that's been with Alabama Care. He has his own company. I'm going to give him a shout out, Lorenzo Brown at Isable. I know he was thinking about possibly trying to provide other services, and so for providers like him, it is a great opportunity to provide other services to a greater number of individuals. And please think about taking that opportunity serious. So when is this new provider or new waiver available? You said it just got passed last week, but is there anybody currently on the waiver?
Yeah, let me talk about that a little bit. So it was approved last week. It launches on November the 1st, but I will tell you, our support coordinators have been really working since January to identify people, begin to reach out to individuals and families to talk about the CWP. We couldn't actually begin to enroll until we had an official approval. So now that we have that, they're beginning to circle back with these individuals and families and actually start the enrollment process. So we should start enrolling people on November the 1st and then thereafter going forward. So it will be, we will have a process of sort of rolling people in. We expect the first month probably across the state maybe to enroll about 35 people, and that double by month 2, and then by January we're up to 200, and by April we anticipate having all the slots filled. So we've given ourselves about 6 months to get all of the allocated slots filled. So, and that's kind of
So
what
in the
we have in
next
our
6
waiver
months,
document.
in the next 6 months, there are going to be a lot of happy individuals and families that may have been
There
on the
you go.
waiting list for a number of years and are just getting contacted and given information about this, and then have access to the waiver there. So if you've been on the waiver
Absolutely.
for a number of years, and you feel like you fit into one of these categories that are eligible, even if somebody hasn't contacted you, is there a way to reach out and see if you're eligible? Is there a good number to call?
I would say if you're already on the waiting list, you should have a case manager. So I would follow up with my case manager to say, hey, I've heard about the CWP, but no one's contacted me, and I live in one of these 11 counties. Can you tell me what's going on? So I got a feeling most people probably have been contacted because we've really worked hard in the last, 10 months to make those contacts. But yes, I would suggest if someone is hearing this today that lives in one of these 11 counties, has had no contact from anyone, to reach out to their case manager.
Awesome.
Who's now
Now
known
you
as
mentioned,
a support coordinator, by the way. We've changed their name. They're support coordinators, even though we still have a tendency to call them case managers.
we have my family member and I have a great relationship with her support coordinator. And I think
Yep,
that's one of the most important relationships for an individual or family to have, because it's your direct access
absolutely.
to services,
Yep.
what those services mean. So please foster those relationships, have open communication, be respectful. And if things aren't going that route, you could always request somebody that may be a better fit. So please pay attention to those.
And I'll tell you too,
Now,
we're working. Back to the support coordinators. We're trying to make sure that they're not overloaded with a caseload. That they are able to actually have a manageable caseload. So they will have, I think, most support coordinators will have a caseload of under 30 people.
okay, kind of like a classroom, a teaching classroom.
Right.
I would like to acknowledge chat really quick. Marcia Sewell asks, is this being recorded for review at a later time or to share with others? Yes, we are currently recording. This video will be available on the Facebook page just as you're seeing it now. And later today, it will be available on the YouTube page. So, feel free to share that wherever you'd like. And Mr. Daryl Powell says, this is a great amount of valuable information. I am excited about moving our state forward with this waiver program. Thank you, Mr. Powell, for being here and supporting everything that we do. As you guys know, Mr. Powell is the head of ACDD, and they are our grantor. So we appreciate you being here with us. I'd like to talk a little bit about the future. And you mentioned more slots opening up. So there's 500 slots this year. If you would talk a little bit about maybe what the next 5 years under this new waiver looks like.
Yeah, I don't have the year by year breakdown, Alex, but I will tell you it's 500 the first year, and we're up to close to 1,700 by year 5. So, and again, as I mentioned, that will be based on attrition slots, and that's without any new funding from our state legislature. And if we get additional funding, those numbers could increase more. But with no new funding and just attrition slots being shifted over to the transferred over to the CWP in the next 5 years, we anticipate moving from 500 to more than 1,600. And eventually, we feel that this will eliminate the waiting list in Alabama. That's the overall goal,
Yeah,
that we eliminate the waiting list.
that would be awesome. And to have some of those results after the first year and hard data to go back and say, hey, if you guys give this more money, we can eliminate this waiting list even quicker. We don't have to wait for that attrition to kind of catch up. So
Yeah,
very
and some
exciting
of the
time.
the evaluation component is measuring things like what you just mentioned. Like, we're going to be able to go to our state legislature and say, because of this new waiver that you funded last year, we had 300 people that obtained competitive integrated employment, averaging a 20-hour work week and earning $9 an hour, just for an example. But those are the kind of things we're looking at in the evaluation component, so we can actually take real data to our state legislature and show that their investment is really paying off in our state.
It always comes across very sharp when you present it like that. And I feel like legislators, they hear it and then they hold on to it and then they carry it forward with them. So if they're able to take that hard data with them, they'll take that into the room when they vote on where that money's being distributed for the state. Now, what are some of the biggest challenges?
Let me say one outside of employment. You will also have individuals and families talk about, achieving a dream of never realizing they could one day have their own apartment and their own lease and, pay their own utility bills and maybe live away from their parents they never thought possible. So in addition to those good employment outcomes, there will be those personal success stories of independence that maybe they never realized they would have an opportunity to share.
We would like to do some of those videos for you.
Yep.
If there's somebody you'd like to highlight, Alabama Care would love to do a broadcast with them, and maybe
I'm hoping we can do things like the first person that obtains a job in the CWP. That's one of our first feature stories. They're in the CWP. They're the first person out of the 500 that got a job. So let's do a feature on them. So that's kind of some of our plans. Yeah, and those are the kind of things I like to do also, by the way. Much more than this.
Well, I really appreciate you being here with us this afternoon. What are some of the biggest challenges that you see in like the next couple of years?
Yeah, there's always going to be challenges with any initiative. And right now, and this is no new news, it's just the news, unfortunately, there is a labor shortage. And I'm sure you're aware that people cannot find employees. Many of our provider agencies that are enrolled in the CWP to provide services, that's one of their huge challenges right now, is finding people who want to work. And then once they find the folks, making sure they get through the required training, because really to be a service provider, this waiver does have very specific training curriculums that the employees will have to complete, especially employment services. There are definitely specific requirements for training. So that is a huge challenge right now. I will say even as recent as about an hour and a half ago, we've had a provider reach out to us saying probably they're going to have to withdraw as a provider because they can't find staff. And, we're about to launch and you start receiving referrals, you need to be ready to go. And so that is, I would say probably right now, that's the number one challenge, is just making sure that our providers have adequate staff to meet the needs of the people that will be receiving services. I will say funding right now seems to be really good. I mean, there's lots of money. I know I've been in state government a long time, and there's been years where I've seen coworkers get laid off because, the budgets were so tight. Right now, because of COVID and other reasons, we have probably more money than we've had in a long time. But, what does that look like in a year or two? Does it switch back the other way where we have no funding? So you never know what your funding situation might look like going forward. I think there will always be, and I'm sure I would experience the same thing, fear and anxiety when you start talking to my family member about possibly living on their own or going to work. And really, families sometimes are the barrier to a person getting a job. The individual would love the opportunity to work, and everything we know about the person shows they would be a great employee. But mom or dad is just like fearful of them having that opportunity, sometimes for safety, and then sometimes the family relies on the SSI check to pay the bills. So that will always be an ongoing thing to have to address. I will say this, kudos to our division here. We have a great staff of community work incentive coordinators that are readily available to meet with individuals and families and talk to them about how working impacts their benefits, their Medicaid, and how they can work. And probably if they lose anything in that SSI check, they're going to gain a whole lot more by getting a paycheck. So we planned that early on because, again, that has been an ongoing barrier for forever. And then last on my list, when I thought about barriers, transportation is always a barrier. Now, we have some transportation services outlined in the CWP. I mean, we're doing things like talking to Uber to see if we can somehow work out some kind of contractual agreement to get reduced Uber rides. So we're still exploring options for transportation. We're working with, like for in Baldwin County, for example, the Baldwin County Rural Transportation System to bring them in as a provider so they can help people get to a job or get to the grocery store or church or whatever it is they want to do to be integrated in their community. So we're definitely realizing that transportation has always been a barrier. Doesn't matter if it's a large city or, some little town like I grew up in, finding ways to hopefully help folks be able to get where they need to get to.
Yeah, and I've lived in a city before where there were trains and there were buses going everywhere, and the transportation was really nice, but it took quite a while to get to the other side of town, and it wasn't the prettiest. You had big buses going around everywhere, but it's kind of a
Yep.
give and take there. Maybe we'll have that. Maybe we'll have a train going from Mobile, Montgomery, Birmingham to Huntsville one day. And then you can get up and down the state and work wherever you want. Go down to Montgomery and work during the day and come back at night. I
I think that'd be
have
great.
talked with other industries, other businesses, and that staffing thing that you mentioned is kind of everywhere right now. It's tough. Companies are
Everywhere.
finding it really tough to, have employees and stick around and provide the services that the company says they're going to do. And I
I
love
was
how you
out
hit on
last night
the.
at
Go
I
ahead.
was out last night at a Mexican restaurant going in to get an order, and they had a sign, just a handwritten sign on the door. There is a national labor shortage. Please be nice to the people that showed up to work today. That's on their door here in
Yeah.
Montgomery. So, and I thought, yes. So even the Mexican
Don't piss
restaurants are
off.
feeling the crunch.
And I also like how you pointed out the kind of protective families there. Sometimes those can be limiting beliefs by the mom or the dad or the family.
Yep.
And if you're in that too long, you can kind of absorb that for yourself. So
Yep.
please don't let others affect your belief in yourself. Do what you want to do. There are a great many people here in the state of Alabama that are supporting you. This new waiver is another way that you can be supported. So believe in yourself, go after what you want to do. Now, as we kind of come to
I
a
will say
close, are
this,
there
Alex.
any?
Yeah, let me say one other thing. I will say this. I've been around for a long time, and usually those parental fears are from the older aging parent who's kind of been very protective of their loved one doing something different. But I will tell you, the younger parent, I think they're more about wanting their loved one, their kid, having the same life that we all have. So I am definitely seeing that shift with the younger parents and with kids with disabilities. So again, I think that eventually works itself out, that the parent part can maybe be marked off the list of barriers. And I
Yeah,
don't, and these people are not bad people. They're not bad people. They're just fearful of change.
I agree. My grandparents, for my family member is my aunt, and she receives services. And my grandparents were kind of fearful for community activities. And when I first moved here to kind of help out with family, that was one of the first things. Is like, well, Bridget can go here. Why isn't she doing those things? She said, oh, we don't know about that. That's uncertain. I'm like, she would
Yep.
love it.
Yep.
And so we've been able to do that more and more over the years as they've kind of softened up. Knowing that.
Yep.
But are there any upcoming events that you would like to highlight and recommend individuals and families get involved in, whether they're in person or online?
I don't have any specific, dates and titles just laid out here. I know for us here, there's a lot of training planned for these providers as we kick this waiver off and get them, ready and equipped to provide the service. So most of the things that's clicking in this brain right now are all CWP provider kind of related things. Now, I will say this, we have organizations like People First that are part of this process, and I know they will have ongoing advocacy and events that they can reach individuals and families. And so, you know, conferences and things right now, honestly, I don't have a list to reference.
And we may reach out to Mrs. Susan Ellis, People First, and see if she would like to highlight some of the work that they're doing with the CWP as a follow
I
up.
think that's a great. I
Yeah,
think that's a great idea.
yeah. And as we kind of close out here, is there anything that we haven't talked about that an individual or family member could benefit from hearing?
No, I just hope that something that I've shared today or in some of our conversation has excited people as much as we're excited here. Again, this is a great opportunity. It gives us an opportunity to really set an example for other states of helping people become independent in their community and also have a successful career. So it's just a great opportunity. And so we talk about challenges. Hopefully those challenges become opportunities.
Yeah, very well put. Mr. White, I appreciate the time that you've given us this afternoon. I am thoroughly excited. I know the community is excited about this new waiver. And so thank you very much for being with us and sharing everything that you guys do.
All right, thank you.
And at this point, we'll go ahead and wave at our cameras and we'll see you next time.